Leprosy has been a disease that has been feared right through the centuries, and in the early part of the 20th century, the 1930s and 1940s, it was still a disease that had no cure. A cure was found in terms of a drug called dapsone and later on with multi-drug therapy, and these were all tried out in various places. Christian Medical College, Vellore was one such place, and one of the doctors there, Dr. Paul Brand, an orthopedic surgeon, began to treat people with deformities and disabilities. He discovered that many of the deformities were due to muscle imbalance caused by nerve damage that is always present in leprosy. This muscle imbalance could be corrected by procedures such as tendon transfers. In order to do this, he had to admit his patients, and he admitted them into Christian Medical College Hospital. And at that time, the people who were the clients of Christian Medical College Hospital were very disturbed because they had to share their beds, their wards with people affected by leprosy. So, the authorities of Christian Medical College, Vellore, wanted a different place in which to treat people affected by leprosy. They asked the local collector for help, and a piece in Karigiri was allotted to them. The land in Karigiri was used to set up an institution called Schieffelin Leprosy Research Sanatorium, SLRS for short. This was in the 1950s when the institution was established and established as a research institution. Dermatology, leprosy, laboratory studies and surgery were started here, and slowly ophthalmology was also added to address the problems of the eye, which were a sequelae of leprosy. Many pioneers in the field of leprosy, such as Dr. Arundhati, Dr. Fritchie, Dr. Melville Christian, Dr. Karat, Dr. C.K. Job, all worked in the field of leprosy in Karigiri. Strides in multi-drug therapy, which is the staple treatment for leprosy even today, was pioneered here in Schieffelin Institute. Schieffelin Institute at that time belonged to the Mission to Lepers, which later changed its name to the Leprosy Mission because it was felt that the word leper not only identified a person by the disease, but also gave the disease as that person's identity. This was not in keeping with the human rights and dignity of the individual, and therefore the Mission to Lepers changed its name to the Leprosy Mission. The American Leprosy Mission funded much of the work here, and the institute was named after one of their early pioneers, J. Schieffelin. The institute in the 1970s withdrew from the Leprosy Mission and became SLRTC, Schieffelin Leprosy Research and Training Center. Research was prioritized, and so was training of people. There were many people who were trained here in leprosy who are serving all over the world. In the early 2000s, the funding for leprosy died down because of the decrease in the incidence of leprosy in South India, and Schieffelin Leprosy Research Institute and Training Center had to fend for itself, and therefore it re-envisaged itself as the Schieffelin Institute for Health Research and Leprosy Center, which is what the name we go by today.
The Department of Dermatology has been serving the leprosy-affected patients since many years. We have quite a few specialists and few medical officers, junior doctors who help in diagnosing the cases of leprosy and managing the complications of leprosy. We do various kind of procedures. We do various kind of tests to confirm the diagnosis of leprosy. And once the diagnosis is confirmed, we go in and do the treatment for these leprosy affected patients. The different types of diagnosis that we do for the leprosy affected or what we call as suspects of leprosy are skin biopsy, slit skin smears, and we have a molecular biology test called the PCR test. So if we get a confirmatory result for any of these, we consider them as a case of Hansen's, and then we go in for treatment of leprosy for these kind of patients. Leprosy affected patients come with many complications, and we call those complications neuritis and reactions. And we ask the patients not to worry about these problems, and if they have anything regarding all this, we ask them to come and seek treatment from the hospital.
So Dr. Margaret Brand was the pioneer of Eye Department in Schieffelin Institute Health, Research and Leprosy Center. In June 1955, Schieffelin Institute of Health, Research and Leprosy Center opened up with a small hospital campus of a 17-bedded hospital, some staff quarters, a little bit of rehabilitation center, and so on. Henceforth, we've been able to give the best care, eye care, for all the leprosy patients that walk into this institution. The cataracts that they develop, we do a phacoemulsification with foldable lens, totally free of cost, and all other eye complaints are taken care of, they're educated, and their eyes are rehabilitated to the extent possible. Now, with the arrival of multi-drug therapy in 1980s, we have seen a decline in the incidence of fresh new leprosy patients. And with the very good field work, epidemiological work, the team has been able to identify these patients early and give them the care, and that's why we don't see much of deformities over these years.
In Schieffelin Institute, our surgeries are mainly concerned with restoring function for those who have disabilities. In leprosy, we find many people who have muscle imbalance, and this muscle imbalance can be corrected by tendon transfer procedures, local soft tissue adjustment procedures. Then, because of the loss of pain, people suffer from loss of tissues because of constant trauma and recurrence of wounds. This loss of pain leads to repeated trauma to particular areas of the body, and there is a loss of tissue, especially on the soles of the feet, on the palms of the hand, on the fingertips, on the toes, etc. We do a lot of surgery to clean all these wounds so that they can heal, and sometimes we need to replace lost tissue with tissue from elsewhere in the body, and so we do soft tissue reconstruction of the sole and soft tissue reconstruction of the palms and web spaces of the hand.
I am Dr. Lakshmi Rajan. I am a pathologist. We get specimens from different areas of our country, mainly leprosy specimens. Leprosy skin biopsies I get from different areas in our country because it's difficult to make a diagnosis of leprosy. One small patch starts, but every patch is not a leprosy. So we have to take a small bit from there and make a slide like this, and then we make a diagnosis of leprosy. Early diagnosis is better because if we neglect it, the patient will develop into deformity. We can ask our different centers to send samples if there is no pathologist there. So I get samples from all over India, and we diagnose here and we give the report within 5 days, 4 days by emails like that.
So this hospital initially started as a leprosy sanatorium where a lot of experimental pathology work was done, and by then our animal house was also running full-fledgedly, and a lot of experiments were done, mice model experiments were done, because this Mycobacterium leprae, what we know is the causative organism for leprosy, doesn't grow in a culture plate, and that's why it is required to be grown in the mouse model, that is in vivo culture. So that's what makes leprosy research a very difficult and a very cumbersome research, because we cannot grow it in a axonic culture. So that's when in the late 90s, that is 1996 onwards, the molecular biology came into conception, where the other researchers like Dr. Sujay, Dr. Lavanya, they started this lab to study a lot of pathology work, a lot of DNA and RNA work, and that's how this molecular biology came in.
Physiotherapy plays a major role in the rehabilitation of a leprosy affected person. Nerve function impairment assessment is done to check the presence or absence of sensation in the hands, feet, and the eyes. The assessment also helps to check the muscle function of the hands, feet, and the eye. Based on the outcome of the assessment, treatment is planned. Patients with weak or paralyzed muscles are taught appropriate massage and exercises. This will help to maintain the muscle strength and also to help improve the functions. Pre- and post-operative physiotherapy also plays an important component or role in the rehabilitation of reconstructive surgical patients. Pre-operative physiotherapy helps to get a patient ready for surgery. Post-operative physiotherapy helps the patient to regain full function of the paralyzed muscle which has been corrected. Physiotherapy is also given to patients who have undergone amputation. Physiotherapy helps the patient to regain the lost functions with the assistance of an artificial limb.
The main role of occupational therapy in leprosy care is prevention of deformities and secondary impairments. So, mainly three ways the occupational therapists can help leprosy patients. One is in preventing the deformities by giving assistive devices and protective devices and splints, and also prevent further deterioration of the injuries or in the hands, feet, and eyes. So, we teach patients in self-care methods how to take care of their eyes, hands, and feet to prevent further damage. And for example, in eyes, neglect of eye care leads to blindness. So we teach them eye self-care methods to avoid further damage to the eye. And also we teach for the hand sensory loss, we teach various methods of protective education. We provide, because during the daily activities, patients come across different pressures during their day-to-day activities in job, in their work, in their day-to-day life. So we have to teach them how to prevent the injuries in the hand due to the loss of sensation in the hands. Also feet, very commonly feet sensory loss is there in leprosy. We tell them how to protect the foot injuries by teaching them self-care. And we also provide lot of assistive devices. In the video you can see the background for people with multiple deformities, how to brush their teeth, how safely they should hold the comb, how safely they can hold a hot tumbler of tea. So different protective devices are there, and sometimes these protective devices also help in the gripping and pinching of the different objects, the tools like the tumblers, plate. So they help in to avoid injuries as well as better grasping of the different day-to-day activity tools.
Department of Prosthetics and Orthotics plays a major role in the field of rehabilitation for the person with disability, especially in Karigiri it is due to leprosy. So we get a lot of leprosy patients. It started with a splint workshop during 1960s when there was a need for making a protective footwear for the leprosy patients. During that time, Karigiri developed this MCR. Leprosy patients have a different type of problems in the feet. It may be only anesthetic feet, where you need to give a simple pair of a footwear, or it may be a foot may be like ulcerated, or it can be like a short feet, it can be like a deformed feet with a bony prominence. So during different clinical conditions, so we have to, that time they were making different kinds of ortho footwear. We recently bought a system where you can scan the patient's foot and then modify and make the molded make the insole through carving machines. Now these infrastructures, we can deliver a molded shoe within 1 hour or 2 hours.
In 1960s, doctors who were there that time, surgeons and physiotherapists, they felt the need for a footwear for the patients, those who are affected with the anesthetic feet. So they wanted to give a protective footwear for the patients with the leprosy, with ulcers, to avoid further ulceration of the foot. During that time, Dr. Mohammed Mapule, that founder of MRF, has come into play. Dr. Paul Brand approached him, and he was willing to help us with that new concept. So he deputed one engineer, Mr. George John, to develop a footwear which protects the foot. In 1965, he developed one sheet that is called microcellular rubber sheet. Initially, it was done at the MRF itself, Madras Rubber Factory itself in Chennai. Then later on, they felt that it has to be established here in Karigiri itself, so that we could develop our own footwears, and we could send it to other leprosy centers also. So by that time, initially we started doing from MRF, we only do press here, hydraulic press here. We get the raw material, we do the hydraulic press, that's nothing but vulcanization. Then later on, we set up our own machineries. Then we started producing our own MCRs. We used to get all the raw material from Malaysia and different parts of the country through MRF. And initially, the size of the MCR which we produce was just 1 feet by 1.5 feet. We can get 1.5 pairs of footwear from that, but now we produce 21 inches by 19 inches size, which we can get nearly about 4 pairs of footwear with different sizes. So the main important of this MCR, what we produce is the shore. That is a hardness measured for the MCR. That we measure with the instrument called durometer. It's a type A durometer, which gives a value of 15 plus or minus 2. That is the shore we maintain for our MCR sheets. We make in 2 sizes, like 10 mm and 3 mm sizes thickness. And 10 mm is used for the footwears, and 3 mm used for the shoes insoles. From this MCR sheets, we make footwears for our patients. And we have different kinds of footwears for the leprosy patients as well as diabetic patients. The footwears are, we cut from the sheets, we cut insoles depending on the size of the patient. It's all customized. So we measure the size, cut the shape of the size from the sheet. Then we make straps out of leather and fit it to the patient. Then we put a bottom sole and make a footwear.
Schieffelin Institute has been a tertiary care center addressing complications in leprosy. The early pioneers of this institute were always concerned about the holistic healing of the person affected by leprosy. In the early years, this concern was addressed through rehabilitation projects, empowerment programs, through self-help groups, and income-generating activities. However, it was only in the early 90s that a full-fledged Department of Clinical Psychology was started to address this felt need to provide psychological support for patients. patients. Since then, there has been a systematic delivery of counseling services, acceptance of leprosy diagnosis, coming to terms with the diagnosis, and also strengthening and enhancing the coping skills of the patients affected. So, the department provides individual counseling, family counseling, and group counseling. The counseling services include support towards treatment compliance and in participation issues. The department has been part of several international research projects, including the development of a scale to measure participation restriction. The psychologist was also part of a team which produced a guideline for stigma. The department also is involved in training, providing training in psychological issues of leprosy.
Schieffelin Institute, located at Karigiri, trains different categories of health workers to ensure that leprosy expertise is retained. A lot of leprosy institutions have patients, but they do not have health workers to cater to the needs of the leprosy patients. We train doctors, that is medical officers, postgraduate doctors in dermatology and other specialties. We also train nurses, we train physiotherapists, occupational therapists, and other categories of health workers so that they can work in the field of leprosy and the leprosy patients will benefit from it. Schieffelin Institute runs different courses for the sake of retaining expertise in leprosy. Some of the courses that are being run are the paramedical workers course, leprosy physiotherapy technician course. We also run ophthalmic course in leprosy and smear technician course. These are some of the courses that are run for a long-term training. There are other courses which are run for a few days, right from one-day orientation program to several days. Schieffelin Institute runs several training programs for the World Health Organization. So people from the Southeast Asia region of the world come to train in leprosy at Karigiri. We also run specialized training customized courses for non-governmental organizations that are located within India and outside the country. We also run training programs for the National Leprosy Eradication Program at the district level, state level, and the national level. District level, we train medical officers, ASHA workers, multipurpose health workers, nurses, and other grassroots level workers. And we also train state leprosy officers and district leprosy officers who come from within Tamil Nadu and from outside Tamil Nadu, from different states, so that they can be trained in leprosy and they go back and train their own people in their settings.
Schieffelin Institute of Health Research and Leprosy Center, as its name suggests, research, we have been quite involved in research since the organization started seven decades ago. And there have been a lot of pioneering works, groundbreaking work that happened at Schieffelin Institute of Health Research and Leprosy Center. To name a few, Schieffelin Institute have been involved in the WHO trial in the initial time when MDT was initiated for leprosy affected patients. And to name a few, the scales like screening of activity limitation and safety awareness, the SALSA scale and the P scale, our staff here were involved in the research activities. Apart from this, presently we are involved in investigative research. To name a few, we are identifying early markers for reaction in leprosy affected patients. Some of the technological innovations that we are presently working on is a tactile sensory feedback system that will identify the anesthetic pressures, peak pressures in the anesthetic feet. And we are also involved in developing offloading devices for leprosy affected patients. If a patient has gotten plantar ulcer, to offload it, we are identifying new devices which can develop or which can be developed instead of the conventional offloading devices that we are using presently. And we are also involved in developing a cloud-based system which will acquire the data of the leprosy affected patient as and when we are entering the data. It will be stored in the cloud and will be able to capture the details or the data of the leprosy affected patients who are coming into the hospital, and we can store this in cloud, and whenever the patient wants to retrieve the data, the patient himself can retrieve the data along with the health workers.
Today, people affected by leprosy are treated free of charge in Schieffelin Institute, despite the fact that the treatment for that is very expensive. We sustain our services through charging our clients, our inpatients, our outpatients, our trainees, and those who come for training in nursing, and those who come for training in various allied health sciences such as prosthetics and orthotics, medical records, laboratory technology, optometry, medical sociology, and those who come for physician's assistants training. Today, Schieffelin Institute stands at the forefront of leprosy research and continues to cooperate with organizations such as the World Health Organization, the National Leprosy Eradication Program of India, and the State Leprosy Society.